COVID cases are increasing across the country. A new study from CU Boulder says if you're thinking you're positive, you really should wait just a little bit to take a test.
So this is a change from everything we have heard before. So that's why we bring in our 9 News medical expert, Dr. Coley. We used to think, gosh, I get a symptom, I got to go test.
Yeah.
I want to tell everybody that I know I'm isolating, I'm out. What's the deal?
Yeah, so that was the guidance for the longest time. And the idea here was it was a new virus. So we had not seen it. Our immune system had not seen it. We had not been vaccinated against it. So the first sign of symptoms means the virus activity has flared. Now that most of us have seen it or been vaccinated against it, or both, the first sign of symptoms might just be our immune system getting tickled and not necessarily enough viral particles around to trigger a positive test. So if we test the first day we have symptoms, our chance of having a false negative can be 90%. And then if we wait a couple of days, it's still pretty high at 70%. So what I usually tell people is do it twice. Test on the day you have symptoms so you can know, but don't let that fool you that it's not necessarily COVID.
Yeah,
makes more
I don't
sense.
see the harm in maybe just taking a couple tests at that point, right?
Exactly.
Especially if you got the little at-home ones that are generally
Well, and then if you do a third one, actually that false negative rate goes down even more. So the more testing you do, it's called orthogonal testing in medicine, the more likely that multiple tests are not going to be wrong. So.
COVID exists in this thing of its own, but do we apply the same standard to flu, RSV, any other things we should be testing for?
No, and that's what's interesting. So those are different viruses with shorter incubation periods. So those viruses split faster. And so by the time you have symptoms with flu or with RSV, you probably have a pretty high viral load. So those tests you should do right away as soon as you're symptomatic. So don't confuse the two.
It feels like, and we're hearing that COVID is surging a little in the summer. Is that because we're out and about, we're traveling, or what's the deal?
Yeah, we think so. But, we thought over the summer, it's hot out, the virus is not as effective, as lingering, but we haven't seen the type of decline that we expected to see, which has been a surprise for the CDC and others. So part of this is our behavior. July 4th travel, busiest travel day that it's ever been. So we're just getting out and about more. But part of it is that the virus has continued to have those variants. The newest generation of variants is called the flirt variants based on the mutations that they have. But what they do is they essentially, trick those antibodies that we have. So even if someone's been infected before, they can get infected again with these flirt variants. So they're just better at infecting us. And that's one of the reasons we're seeing more cases.
Should we be doing anything to try to be thoughtful and cautious about that?
I still see masks.
Yes, especially as we travel. So summer, it's a little harder to wear masks, right? Because it's hot out, it's humid, it's hard to breathe and all of that. But what I do is I do selective masking. So when I'm on the train at DIA, where everybody's cramped in and there's no ventilation and we're all kind of facing each other, I'll just put my mask on at that time. But I'll take it off when I'm on the plane and the ventilation system is going and such. So think about masking selectively, especially if you're in areas where transmission may be high. So take a look at that map, see where you're going to travel this summer, if it's going to be high or not. The hand hygiene and the surface hygiene is really important. And I have not seen anyone wipe that tray table on the plane as much as I do, but
planes are kind of grimy.
They
anyway.
are, exactly. And so let's not forget that. Just because we're now realizing the virus is not as aggressive, it still makes the immunocompromised sick and the young people and the elderly sick. And we still don't want to miss days and get COVID.
Yeah, and take care of the people around you. I mean, you have those people around you that you don't want to get sick and potentially exposed. Are we talking vaccine yet? Are we thinking fall, like
yes.
time?
So there's a new vaccine cooking, and Pfizer and Moderna both have new vaccines. Now, this is actually based on a prior generation called the JN1, which is an Omicron descendant. So not the current variants that are floating around, which I'm a little disappointed about. I would hope that they could now, at this point, after so many versions of the vaccine, have a newer variant coming, but it will be coming, and it is recommended for everyone over the age of 6 months. Now, if you say I've had COVID before, I've had the vaccine before, these variants are completely different than the ones from 2 years ago. So just don't let your guard down. Protect yourself so that you can have a really nice back to school season and sort of stay healthy.
It'll be in about 10 seconds and you'll be back in here talking about flu season, and all the other vaccines we need to get.
I mean, that summer is flying by for sure.
Thank you, Dr. Coley.